Okay. Whom are the audience of the radiology report and how to write impression? Dr. Ibrahim Shalaby. The radiology report is the sum of the radiologist's highest level of senses, which mean practice, and his insight into the patient's conditions, its visions for the patient. So, radiology report is the sum of your level of practice and special vision to this patient condition. You must know, radiology, it is the answer of the question with no of the limitation of the answer. Limitations of the answer also involving if there is malpractice or decrease of the quality of the study, so your answer will be limited. This is the shape of the reports. We having firstly the titles and what we do inside it, then the clinical asked questions. We must answering of clinical asked questions as the opinion. Then the finding, then we have the opinion and the recommendations. So we have 6 items of reporting. First, the title, what we do, the clinical asked questions, the finding, the opinion, the recommendation. You must know that the audience of your report, it is not the providing physician. Many audience for your reports, at least 4 types at each report will see your report of different and even conflict way. Who are these readers? First, the radiologist in your room when you are reporting primary report for them, or another one who may taking a second decisions. The second radiologist, the second reader, the second audience of your report is other radiologist who can see your reports after 1 year, 2 years, 3 years for follow-up, or the radiologist will do the further recommendations. The third audience are the primary care providers, which are already needing clear specific recommendations as family medicines, some medical doctors. Type 4, subspecialty physicians, oncologists, okay, surgeons. They need a specific language, okay? They need details, especially the oncologist needing to tell them the tumor oncology staging. However, you can, if it is the provider is primary health care, you see to him this renal cell tumors, he will be satisfied. But this report, when come to the subspecialist, he will not be satisfied. The 5 is the patients, which will read the opinion and try to translate it. 6, the billing and the health insurance. Will they read the report and I will say this will be coming few years in Egypt, read it directly and know what this done or not and what is the quality for billing. The research may be using these reports. And lastly, the layers. However, you must use protective language to avoid the risk of malpractice. Again, we log these reports after we know your audience. So, the layers will be think about the reports 1, 2, 3, okay? The medical professionals will read mainly the opinion, okay? So, this language of the opinion will not be the language of the finding. How to create clear reports? Provide the diagnosis and the supporting finding. Please, reporting in understandable language. Avoid clinical insignificant information. Provide relevant data recommendation. You must know your recommendations. Work on improving report based on provider feedback. You must asking for feedbacks, pathology, operative details. You may use highlighting the short informative in the finding sector. Please, write complete sentence. Don't use FHD, LSD. Ideally, finding should be distinct and separate from the impressions, not to make the impression and the finding in one catalog. Ensure the observations are kept brief. Remember, we have two languages, radiologist language and another language. Only at the finding using the radiologist language. At the impression, at opinion, you must know that radiologist audience are want to know what you want to tell them with simple way. Impression. The impression favors a universal medical lesson from medical school. Your impression must be fit this, even for residents. In addition, unnecessary aided by formal sentence structures which may be difficult to some bodies, not be given the official appearance of the report. For example, we can, in the impression, say demonstration of multiple liver lesions consistent with hepatic metastasis, which have increased in the size in the interval. Okay, everyone will see it. Liver metastases have enlarged. Require no translations. When you are in the team meeting, this will be very clear for all persons are in the room. Need for translations. The ordering providers need three things. First, the clinical questions want you to answer it direct. Second one, any another important rather than a question must be adequate reported. Third thing, what's your recommendations? In your report, deliver the good, I mean the impression. Anchor the impression with diagnosis or differential diagnosis followed by clinical finding supporting it. Example, imaging features in the conclusion of acute interstitial pancreatitis as regards the edematous pancreas and pancreatic free fluid. You make the diagnosis and you make the supporting of the diagnosis in the conclusion with the language the clinicians understand it. Stated clearly. In impression, you are not talking with your radiologists. Your impression must be clear for providers and the MD team. Reporting as, example, right renal mass of stage T3A N0 as regards the renal vein invasions, not using, in the impression, soft tissue mass of neoplastic criteria at the left kidney. Keep it relevant. Avoid use clinical prevalent finding at the impression. Not require any medical follow-up for treatment. Like in lumbosacral MRI, don't mention in the conclusions hemangioma. At the case of cancer head of pancreas, advanced, don't mention in the conclusion there is simple renal cyst need for follow-up. Think about the next step. Provide good recommendations that help the provider to diagnose or take the action of the management. Example, not to use PET-CT for all cases of oncology, only for the needed cases. Continue to grow. You must ask it for the feedbacks, the result of biopsy. You must be in the MDT meeting. You must asking about the operative details. And lastly, before you have a machine, have a team. Thank you. Any question?
Ibrahim? Thank you, everyone.